And it still shocked me just to think that psychiatry used to treat mental patients in this way. But I heard it's still legal, though. Those electric shock treatments,
Yes,
you call
it
lobotomy,
is.
it's still legal, right, in this country?
Yes, they use it for they say retractable depression, and it's I'm sure it's improved, the techniques improved,
Yeah.
but it's still known that even though you're depressed, there are other methods that you could use other than that, but it does cause memory loss. It really
Yeah.
literally fries the brain, and that's one way of describing it. No matter how gentle the technique is these days. So, and I know people who had electroshock therapy when they were teenagers, a particular relative, and
Yeah.
she doesn't remember large chunks of her childhood. So it really, and especially for young people like teenagers, when their brains are developing, to
Right.
have something like that to curtail the development. And so I particularly relate to that, and also my experience, which proved when I looked in the history books to say that some nurses were petrified trying to help these patients. They
Yeah.
called it Frankensteinish
Wow.
techniques
Yeah.
because of how they had to hold the patient down with six people, six nurses, just to get them to stay put on the table.
Right.
And so I know this from history, and also reading a lot of doctoral dissertations when I was at Teachers College. They had the fourth floor, and a lot of nurses wrote about the situations in psychiatric nursing, but also in hospitals, and their experiences were similar.
Right. I know that this is a there's a name for it, isn't it? For vicarious trauma. When you don't know what to do, really, then it's actually becomes a
Exactly.
trauma for the
Hmm.
professional too.
Hmm.
Wow, Christine.